Do you often feel unusually tired, dizzy when you stand up, or crave salty foods? These everyday clues can hint at a problem called tertiary adrenal insufficiency, a condition where the brain's pituitary gland does not tell the adrenal glands to make enough cortisol, the hormone that helps you handle stress. Imagine your body's alarm system, the pituitary, losing its battery. The adrenal glands, the responders, stay quiet, leaving you feeling weak and low on energy. This short guide will walk you through why it happens, what to watch for, and how doctors can help. The word tertiary tells us the problem starts in the pituitary gland, the third level in the hormone chain. Pituitary tumors that press on normal cells. Pituitary surgery or radiation that unintentionally damages tissue. Sheehan's syndrome, where severe bleeding after childbirth starves the pituitary of blood. Autoimmune attacks that target the pituitary. Think of the pituitary as a small command center. Anything that hurts it can stop the signal ACTH that asks the adrenal glands to release cortisol. If the pituitary is not sending the right signal, you may notice constant fatigue, like you have run a marathon without training. Dizziness or faintness when standing up quickly, low blood pressure. Craving salty foods, because the body loses sodium without cortisol. Weight loss and lack of appetite. Darkening of the skin is rare in tertiary insufficiency, more common in primary. Imagine trying to drive a car with a flat tire. The ride feels sluggish. You need to press the gas more often, and the dashboard lights, your body's warning signs, keep flashing. Doctors usually start with simple blood tests. Morning cortisol level, low values suggest a problem. ACTH stimulation test. They give a synthetic ACTH and watch if cortisol rises. A weak rise points to adrenal insufficiency. MRI of the brain, to look at the pituitary for tumors or scarring. Treatment is replacement therapy. Hydrocortisone tablets, taken 2 or 3 times a day, mimic natural cortisol. On stressful days, illness, surgery, heavy exercise, you double or triple the dose. Think of it as adding extra fuel when you're climbing a hill. Some doctors use long-acting steroids, like prednisolone, for convenience, but they need careful monitoring. A practical tip: keep an emergency injection kit, hydrocortisone IM, at home and wear a medical alert bracelet. Because the problem starts in the pituitary, preventing it means protecting the command center. Follow up after pituitary surgery or radiation. Regular MRI scans catch problems early. Manage underlying tumors with medication or surgery before they damage the gland. Avoid abruptly stopping steroids if you have been on them for a long time. Taper slowly to give the pituitary a chance to recover. Pregnant women with heavy bleeding should be monitored for Sheehan's syndrome. Think of prevention like regular maintenance on a car. Checking the oil, pituitary health, avoids a breakdown later. Improved hormone assays can detect tiny changes in cortisol, allowing earlier diagnosis. Long-acting hydrocortisone formulations, once daily pills, are being tested to simplify dosing and improve quality of life. Gene therapy studies aim to restore ACTH production in rare genetic pituitary defects, though still experimental. Wearable cortisol sensors are in early trials, offering real-time feedback on stress hormone levels. These advances are like adding a GPS to the car's dashboard, giving patients and doctors clearer, real-time information